In the second section of our lecture, Infections Acquired in Pregnancy, we will discuss cytomegalovirus infection and chicken pox. In this, we will discuss the causative agents of cytomegalovirus and chicken pox. What are the effects of these two infections on pregnancy and fetus, and then what's the management of cytomegalovirus and chicken pox. So first, the cytomegalovirus, the causative agent is as the name shows, is the viral infection, and the virus that causes cytomegalovirus is DNA herpes virus. So DNA herpes virus causes cytomegalovirus infection. The 30% of pregnant women without cytomegalovirus antibodies. So cytomegalovirus infections, the pregnant women who have this infection during pregnancy, out of them 30% do not have any antibodies, cytomegalovirus antibody. 1% primary infection during pregnancy. 40% fetal infection is present. Out of this 40% fetal infection, about 80% is asymptomatic and 20% is symptomatic. Out of more are asymptomatic, about 80%, and in this 80% which are asymptomatic, 90% they develop normally and they have no symptoms at all. But out of these 80%, 10% develop the sequel, and this sequel is hearing difficulties and they have mental retardation. So we have 80% asymptomatic, 20% symptomatic. Asymptomatic, we have 90% which develop normally, only 10% develop the changes or the abnormalities, which include hearing difficulties and mental retardation. Then if we go to the 20% symptomatic cases, symptomatic usually there is fetal growth restriction, hepatomegaly, ventriculomegaly, microcephaly, purpura retinitis. So these are the different features that can present. Out of these 20%, 10% again develop normally, and 90% now develop the sequel, which will have mental retardation, hearing difficulties and motor retardation. So 80% which are asymptomatic, they have better prognosis. 90% develop normally, only 10% can have the abnormalities. But in other case, 20% which are symptomatic, 10% develop normally, but mostly they have problems like mental retardation, hearing difficulties and motor retardation. 70% pregnant women with cytomegalovirus antibodies. So we mentioned already 30% are without CMV antibodies, but 70% will have antibodies. 0.2 to 2% fetal infection due to reactivation, and 0.5 to 1% symptomatic infection. So if antibodies are present, there is less serious damage to the fetus because there are antibodies present in the maternal blood. Next, the clinical features of cytomegalovirus. Cytomegalovirus is passed to fetus through placenta, so it can cross the placenta and can affect the fetus. Primary infection, no symptoms or mild flu-like symptoms are present. Feature scenes, and if the infection reaches the fetus, it can cause growth restriction, microcephaly, intracranial calcification, ventriculomegaly, ascites, or hydrops fetalis. All these can occur if the infection reaches the fetus. It causes growth restriction, small head, calcification in the cranium, enlargement of the ventricles, and there is ascites, means there is fluid in the abdomen, and also hydrops, there is fluid in the other parts of the body also. The management of cytomegalovirus, the diagnosis of primary maternal infection confirmed. So if it is confirmed that the mother is infected with cytomegalovirus, perform amniocentesis to assess for virus in amniotic fluid by culture or polymerase chain reaction. Perform comprehensive ultrasound. So if it's diagnosed, then we should remove the amniotic fluid to culture the virus from the fluid, and also ultrasounds should be performed. Then after these tests, if no virus detected and normal ultrasound is present, then we should repeat ultrasound in 3 weeks. Consider repeat amniocentesis also, reassuring findings, no treatment indicated. So after the test on after amniotic fluid and after ultrasound, no abnormality is found, then we don't need any treatment, reassurance should be done. Then if there is virus detected on amniotic fluid culture and there is normal ultrasound, prophylactic doses of intravenous hyperimmune globulin 100 units is given per kilogram monthly, and then approximate wholesale cost of hyperimmune globulin is 2.5 gram vial is about $150. So it's very, very expensive treatment. Hyperimmune globulin is about $150. If virus is detected and there is abnormal ultrasound also, usually termination versus treatment with hyperimmune globulin, and then serial ultrasounds and retreat as indicated. So the treatment options depend on the findings of ultrasound, on the findings of the amniotic fluid culture, and then if the abnormalities are present, then we should treat, and if both the culture and ultrasound are abnormal, usually we should choose between the treatment and termination of pregnancy. Chickenpox. Chickenpox is caused by the varicella zoster virus. Non-immune pregnant women develop serious pneumonia, hepatitis, or encephalitis. Mortality rate 5% higher in pregnancy than in non-pregnant women. You can see the rash of chickenpox here also. Cause fetal varicella syndrome. The management of chickenpox, exposure to varicella, well-documented history of infection, then we should reassure patient that neither she nor her baby is at risk. No documentation. If there is well-documented and history of, then we should do the reassurance. But if there is no documentation of infection, usually we should obtain varicella zoster, IgG serology is performed. If it's positive, reassure patient. If it's negative, administer prophylaxis with varicella zoster immune globulin or acyclovir or valacyclovir. Again, if there is no infection develops, reassure patient. If there is acute varicella developed, if it's depending on if it's mild or severe, then the treatment for mild is oral acyclovir or valacyclovir. If it's severe, then we treat with intravenous acyclovir. And then we evaluate the baby with ultrasound if there are any signs of infection or not. So again, management, if there is exposure to varicella, we should find out if it's well documented or not well documented. And then if it's not well documented, we obtain varicella zoster IgG serology. If antibodies are present, then it's reassure the patient. If it's positive, then no treatment. But in case if it's negative, then we administer prophylaxis with varicella zoster immune globulin or acyclovir or valacyclovir. Again, if no infection develops with this, then we should reassure the patient. But in case infection develop, if it's mild, treatment is oral. If it's severe, treatment is by IV acyclovir. Then effects on the fetus. Skin scarring in a dermatomal distribution is present. Eye defects like microphthalmia, chorioretinitis, cataracts are present. Hypoplasia of limbs is present in the fetus. Neurological abnormalities like microcephaly, cortical atrophy, mental restriction and dysfunction and of bowel and bladder is present. So all these are the complications of the chicken pox on fetus. It affects the eyes, limbs, and it can have different neurological abnormalities also. So that was all about cytomegalovirus and chicken pox. Thank you for watching sqadia.com.